How do policy changes impact homeless services? Imagine trying to find a safe place to sleep or a job after being released from prison. Now picture how government policies can make that process easier or harder. Changes in policies can really shape the support available for people experiencing homelessness or reentering society. They decide how much money goes to homeless programs like emergency shelters, permanent supportive housing, and rental assistance. When policies increase funding, more beds open up, and more people get help. But if funding gets cut or redirected, services shrink, leaving many without a place to stay. This especially affects returning citizens who need stable housing to rebuild their lives. Policies also influence what kind of programs are prioritized. For example, the housing first approach focuses on giving people a permanent home without preconditions. This method has helped many find stability faster. Still, it does not always reduce overall homelessness if other supports like mental health care or job training are not included. Policies that define who counts as homeless also matter. If definitions are narrowed, some people might not be counted or helped, even if they are in need. Accurate definitions help ensure resources reach those who need them most, including returning citizens with complex needs. Different policies impact vulnerable groups in various ways. People living outside without shelter, especially those with mental health or substance use issues, face more challenges when policies do not address their specific needs. When policies combine housing with mental health and addiction services, outcomes improve. Prevention programs are also key. Policies that fund eviction prevention or rental assistance can stop homelessness before it starts, especially for those leaving incarceration. Coordinated efforts between criminal justice, housing, and social services help provide stable housing, mental health support, and job opportunities, making reentry smoother. Broader economic and social policies also play a role. When affordable housing is scarce, or when pandemic supports end, homelessness can increase. Policies that promote affordable housing development, employment programs, and social safety nets are essential to meet rising demand. For reentry support, policies that boost funding for supportive housing, expand emergency shelter capacity, and integrate mental health and job training services create stronger chances for success. On the other hand, policies that cut resources or focus only on housing without support can leave returning citizens without the help they need, making it harder to avoid homelessness and succeed in their new lives. Overall, policy changes shape the resources, strategies, and populations served by homeless services. When policies focus on comprehensive support, including housing, mental health, and employment, they help reduce homelessness and support successful reentry. Conversely, policies that limit funding or narrow focus can make it more difficult for people to find stability and rebuild their lives.